everyone, welcome to Meena Super Speciality Hospital, Atapur. Welcome to Ophthalmology Department. Dr. Hidayatullah Khan, MBBS, MS, MCH, Gold Medalist. Known from the eye checkup to expert surgeries, Dr. Hidayatullah Khan, Gold Medalist eye surgeon at Meena Hospital, is highly regarded for his expertise in cataract, refractive and corneal surgeries, known for precision, advanced surgical skills and compassionate patient care. He is dedicated to providing world-class eye treatment and restoring vision with excellence, continues to set high standards in the field of eye health and surgery.
You all, what you have witnessed just now is a PRK procedure, which is a refractive surgery procedure done to remove the refractive error of the eye. So what we had done in this patient is the patient had a refractive error of around 2.5, minus 2.5 spherical error. So what we had planned is a photorefractive keratectomy in that patient. The patient had a corneal thickness of around 520 microns in both the eyes, around 520 microns. The patient opted for a photorefractive keratectomy procedure. In this procedure, what is done is we usually clean up the eye with antiseptics and disinfectants and all. Then we take up the case for surgery after putting some antibiotics and all those things. And once the speculum is put and the cornea is exposed very nicely, and a well is taken and placed over the cornea, and then in that well we use alcohol, diluted alcohol, so that alcohol acts on the epithelium and makes the epithelium loose, so that it can be debrided very easily for the PRK procedure to be done. So once the alcohol is placed in the well for 20 seconds, the epithelium becomes loosened up. We remove the well and wash off the excess alcohol, and then we debride the epithelium with a hockey stick like instrument in this thing. Once the epithelium is removed in a fashion, around 7 to 8 millimeter area of the epithelium is removed there. So we clean up the bed and we dry the bed completely. So after drying up the bed with Merocel sponge, then we place the eye tracker there and we do the excimer laser procedure. What depending upon the refractive error, the depth of the ablation is decided by the machine. In this case, what we applied was 56 microns. So in both the eyes. So 56 microns ablation was done there with the excimer laser, which is an argon fluoride gas laser. So that went on for a few seconds. And once the procedure, the ablation is completed and the cornea is flattened out, the power is removed. So after the removal of this thing, we have applied one medicine there that's called mitomycin C. Mitomycin. The mitomycin, it acts and helps in preventing the occurrence of gaze in these PRK patients, as well as it helps in regression also. So and then the epithelium, what has been removed, is covered with a bandage contact lens. This bandage contact lens will be in place for 3 to 5 days. Once the epithelium is completed and the patient is monitored and seen in slit lamp on first day post-operative and then 4th and 5th day post-operative. Once the healing is completed, epithelial healing is completed, the contact lens is removed. So the patient's full visual potential by the end of 1 week to 10 days, the patient will have his full visual potential for both for distance as well as for the near. Accordingly, the medications will be prescribed. What the medications usually, when the epithelium is healing, we try to avoid steroids. We put the patients on antibiotic eye drops, NSAIDs and lubricants. And once the epithelium heals off, then we add steroid to that, and that this steroid is tapered over a period of 6 to 12 weeks, depending on the patient's response, and all those things are there. So we need to follow up the patients for at least 2 months. Then the patient is good enough to carry on his routine work. Thank you. Thank you so much.